Pulmonary embolism is a blockage in one of the aspiratory conduits in your lungs. Primarily, pulmonary embolism is brought about by blood clumps that movement to the lungs from profound veins in the legs or, infrequently, from veins in different pieces of the body, profound vein apoplexy. Since the coagulations block bloodstream to the lungs, and aspiratory embolism can be dangerous. In any case, brief treatment extraordinarily lessens the danger of death. Taking measures to forestall blood clusters in your legs will help secure you against aspiratory embolism. Indications: aspiratory embolism manifestations can fluctuate incredibly, contingent upon the amount of your lung as included, the size of the coagulations, and whether you have basic lung or coronary illness. Basic signs and manifestations include windedness. This manifestation regularly shows up abruptly and consistently deteriorates with effort. Chest pain. You may feel like you're having cardiovascular failure. The agony is regularly sharp and felt when you take in profoundly, frequently preventing you from having the option to take a full breath. It can likewise be felt when you hack, twist or stoop. Hack. The hack may deliver wicked or blood-streaked sputum. Different signs and indications that can happen with pneumonic embolism include fast or unpredictable heartbeat, unsteadiness or tipsiness, unnecessary perspiring, fever, leg torment or expanding, or both, as a rule in the calf, brought about by a profound vein apoplexy, sticky or stained skin, cyanosis. When to see a specialist, pneumonic embolism can be hazardous. Look for pressing clinical consideration on the off chance that you experience unexplained windedness, chest torment, or a hack that produces wicked sputum. Causes: pulmonary embolism happens when a bunch of material, frequently blood coagulation, gets wedged into a vein in your lungs. These blood coagulations most generally come from the profound veins of your legs, a condition known as profound vein apoplexy, DVT. Much of the time, numerous coagulation are associated with aspiratory embolism. The segments of the lung served by each obstructed conduit are ransacked of blood and may pass on. This is known as aspiratory dead tissue. This makes it harder for your lungs to give oxygen to the remainder of your body. Sometimes, blockages in the veins are brought about by substances other than blood clumps, for example, fat from the marrow of a messed up long bone, part of a tumor, air bubbles, hazard factors. In spite of the fact that anybody can create blood clumps and result in aspiratory embolism, certain variables can expand your danger. Ailments and medicines: you're at higher danger on the off chance that you or any of your relatives have had venous blood clumps or pneumonic embolism before. Also, some ailments and medicines put you in danger, for example, coronary illness. Cardiovascular sickness, explicitly cardiovascular breakdown, makes cluster arrangement almost certain. Disease. Certain malignancies, particularly the cerebrum, ovary, pancreas, colon, stomach, lung, and kidney diseases, and tumors that have spread, can expand the danger of blood clumps, and chemotherapy further builds the danger. Ladies with an individual or family background of bosom malignant growth who are taking tamoxifen or raloxifene likewise are at higher danger of blood clumps. Medical procedure. The medical procedure is one of the main sources of issue blood clumps. Consequently, prescription to forestall clumps might be given when the significant medical procedure, like joint substitution. Problems that influence thickening. Some acquired problems influence blood, making it more inclined to clump. Other clinical problems, for example, a kidney infection, can likewise build your danger of blood clusters. COVID illness 2019, COVID-19. Individuals who have extreme side effects of COVID-19 have an expanded danger of pneumonic embolism. Delayed idleness: blood clusters are bound to frame during times of idleness, for example, bed rest. Being kept to bed for an all-inclusive period after a medical procedure, a coronary failure, leg break, injury, or any genuine sickness makes you more powerless against blood clusters. At the point when the lower limits are even for extensive stretches, the progression of venous blood eases back and blood can pool in the legs, in some cases bringing about blood clumps. Long outings. Sitting in a confined situation during extensive plane or vehicle trips eases back the bloodstream in the legs, which adds to the arrangement of clumps. Other danger factors: smoking. For reasons that aren't surely known, tobacco use inclines a few groups to blood clump development, particularly when joined with other danger factors. Being overweight. Abundance weight builds the danger of blood clusters, especially in individuals with other danger factors. Supplemental estrogen. The estrogen in contraception pills and in chemical substitution treatment can build coagulating factors in your blood, particularly in the event that you smoke or are overweight. Pregnancy. The heaviness of the infant preceding veins in the pelvis can moderate blood get back from the legs. Clusters are bound to shape when blood eases back or pools. Intricacies. Aspiratory embolism can be dangerous. Around 33% of individuals with undiscovered and untreated aspiratory embolism don't endure. At the point when the condition is analyzed and treated instantly, notwithstanding, that number drops drastically. Pneumonic embolism can likewise prompt aspiratory hypertension, a condition wherein the pulse in your lungs and in the correct side of the heart is excessively high. At the point when you have blocks in the courses inside your lungs, your heart should work more enthusiastically to push blood through those vessels, which expands pulse and ultimately debilitates your heart. In uncommon cases, little emboli happen regularly and create after some time, bringing about ongoing pneumonic hypertension, otherwise called persistent thromboembolic aspiratory hypertension. Counteraction. Forestalling clumps in the profound veins in your legs. Profound vein apoplexy will help forestall pneumonic embolism. Consequently, most clinics are forceful about taking measures to forestall blood clumps, including blood thinners, anticoagulants. These prescriptions are frequently given to individuals in danger of clumps when in activity, just as to individuals conceded to the clinic with ailments, for example, coronary episode, stroke, or confusions of disease. Pressure stockings. Pressure stockings consistently crush your legs, helping your veins and leg muscles move blood all the more proficiently. They offer a protected, basic and modest approach to hold blood back from deteriorating during and after broad medical procedures. Leg height. Lifting your legs whenever the situation allows and during the night additionally can be successful. Raise the lower part of your bed 4 to 6 inches, 10 to 15 centimeters, with squares or books. Actual work. Moving quickly after a medical procedure can help forestall aspiratory embolism and hurry recuperation. Generally speaking, this is one of the fundamental reasons your attendant may push you to get up, even on your day of medical procedure, and stroll regardless of agony at the site of your careful entry point. Pneumatic pressure. This treatment utilizes thigh-high or calf-high sleeves that naturally swell with air and collapse at regular intervals to back rub and crush the veins in your legs and improve your bloodstream. Avoidance. While voyaging, the danger of blood clumps creating while at the same time voyaging is low, however, increments as long stretch travel increments. In the event that you have hazard factors for blood clumps and you're worried about movement, talk with your primary care physician. Your PCP may propose the accompanying to help forestall blood clumps during movement. Drink a lot of liquids. Water is the best fluid for forestalling parchedness, which can add to the improvement of blood clumps. Keep away from liquor, which adds to liquid misfortune. Enjoy a reprieve from sitting. Move around the plane lodge once an hour or something like that. In case you're driving, stop sometimes and stroll around multiple times. Do a couple of profound knee twists. Squirm in your seat. Flex your lower legs each 15 to 30 minutes. Wear support stockings. Your PCP may prescribe these to help advance dissemination and smooth motion in your legs. Pressure stockings are accessible in a scope of in vogue tones and surfaces. There are even gadgets, called loading head servants, to help you put on the stockings.